I like. What's up, world? Welcome to another edition of I Mix What I Like Live. Again, I'm Jared Ball. Welcome back to Black Power Media, Grand Rising. Greetings. Thanks again for joining us. Welcome. Come on in. Like my man Math Hoffa says, get in here. Get in here. Definitely feel much better today. Yesterday obviously was tough. I appreciate you all for your comments. I went back and saw what many of you had to say about my commentary about Glenn Ford, and I really appreciate that. That was definitely not easy, and I appreciate your responses, and we continue to wish him and those around him the best, and wish that we can carry on his legacy. So I appreciate all of that. Similarly, in a sort of similar but different vein and direction, before we get started today, I guess kind of pun intended, vein, bars, site. Please continue to share and consider your support for Sister Katia Stitt and her medical, the condition, the support for her medical hospitalization and medical treatment and ongoing care. And again, as I've been saying, and we've been saying all week, and I'm going to again put the link in the chat. Her support is more than deserved, and not to continue to play off of each other, these two people and issues, but certainly someone who supported the spreading of the work of Glenn Ford. She has helped air his commentaries. Certainly, when I was on the station, we brought him on, and his commentaries constantly. She's a big supporter of Barr. But more importantly, she's a supporter on the level of work and need that many of us don't aspire to. That is the behind the scenes, the unheralded work, the offline work. She is perfectly emblematic of all of that level of the struggle, as people like Glenn, and to a much lesser extent, me and others, are playing a different role. So we want to continue to raise her up and invite people to continue to support her. And as I said the other day, the levels of support she's received, speaking only for myself, is just insufficient so far. So please do consider chipping in and spreading the word as best you can. And I know she and we and the universe, so to speak, and the struggle, so to speak, will all appreciate it. So and I wish you, Katia, a speedy recovery. All right. Now, before we get to our guests, a lot of people have been asking, commenting. So as we continue to invite you to bring people in, as I'm just holding it down here on a Friday morning until the Remix Morning Show reconvenes. By the way, on Monday, as I hold it down again, Monday morning, we're going to get into a number of things, including the after party concept a little bit more, and but specifically through the lens of some work my brother and comrade sent me late last night, this morning, or in pieces, or one anyway. But some 1972 New York Times Black Economic Roundtable discussion. And I think folks will find fascinating what and who was saying what then and how it relates wildly to what is going on right now. So we're going to get into that and a few other things on Monday. But anyway, but as it goes for today, I'm very excited for a number of reasons about this conversation. Number one, it was spearheaded by one of my favorite people in the world, who you'll get to meet here in just a minute. But also because it's touching on an issue that, we got into it on the remix a little bit. I know it's a hotly discussed and debated issue within our communities. A number of people have been reaching out already about this discussion, and I've been reminding them this is a biased discussion. This one is a discussion decidedly in favor of vaccination, and you'll hear all the reasons why. So we're not getting into the debate as to whether or not we should. We're getting into a discussion in detail about why these folks say we should. So I want to just be clear on that. We will be mindful of other people's views on this, but that's what this discussion is for. This is not the end of all discussion. We as a channel are not shutting down discussion of this issue. This is maybe a beginning, but this is one version that we wanted to proffer. And I think, as I've already alluded to, and our guests will describe further momentarily, there are reasons why. So, all right, that's it. So the among the guests that we're going to have today, that I'm going to bring up here in just a minute, is Gina Arias, who is a registered nurse and public health professional who participated in the New York City Department of Health COVID-19 vaccination rollout efforts in the spring. She currently works for Times Up as the director of healthcare. We're also going to have Dr. Obi Nnedu, who is an infectious diseases physician with 11 years of experience practicing in New Orleans. He serves as the program director of the infectious diseases training program at Ochsner Medical Center. He attended medical school at the University of Alabama, completed his residency training at Tulane University in New Orleans, and specialized in infectious diseases at the University of Washington in Seattle. We're also going to be joined by my man, one of my favorite people in the world, admittedly, Dr. Joaquin Morante, who was raised in New York City. In his youth, he developed an interest in community organizing and empowerment. He completed his medical education at the Escuela Latinoamericana de Medicina in Havana, Cuba. Dr. Morante completed his residency in internal medicine at Woodhull Medical and Mental Health in Woodhull Medical and Mental Health in Brooklyn, New York. He subsequently completed his training in pulmonary disease at Jamaica Hospital Medical Center and critical care medicine at Montefiore Medical Center. Joaquin works at Jacobi Medical Center and is an assistant professor of medicine at the Albert Einstein College of Medicine. My man. Well done. My other man, and by the way, is an ancillary brother, as is my next guest, to the Africana Studies and Research Center under Dr. James Turner version at Cornell University. Just want to put that in there as well. Also is joining us is Dr. Joanelle Defnis, who is an emergency medicine physician that has been practicing medicine since 2007. He is a diasporic African of Haitian descent, but currently resides in New Orleans with his wife, Dr. Emily Nichols, and their daughter, Zumbi. He received his bachelor's in science and development sociology from Cornell University in Ithaca, New York in 1998. And as I said, that related, his Master of Public Health from the Division of Population and Family Health at Joseph L. Mailman School of Public Health at Columbia University in New York City, New York in 2000, and his Doctor of Medicine at the State University of New York School of Medicine in Stony Brook, New York in 2007. He completed his emergency medicine and internal medicine combined residency at the Kings County Hospital in New York, Brooklyn specifically, New York, in 2012. I welcome all of you to the program. Good morning. Thank you very much for joining me and us. It's a pleasure to see all of you. Peace. Joaquin, my man. Good morning. Janelle, good morning. Obi, Gina, welcome.
Good morning. Good morning.
Good morning.
So before we move on, is there anything in the bios I left up, mispronounced, said anything wrong that we need to clarify before we move on? Anything? Obi, you're muted. I want to make sure. Just want to make sure.
The only thing I would add is that I'm here speaking on my behalf and not through my job.
Right. Okay. And you're not representing every registered nurse in the United States or the world. No, I'm just playing. So listen, obviously the chat group that we've been in is as lively as the world around us is on these issues. So as I said, I just wanted to start broadly with the question of why are you pro-vaccination? What, from your perspectives in your work, are you seeing or has led you to conclude that you feel it even more necessary that we speak specifically to Black and Brown communities, saying we need everybody to get vaccinated? And Gina, we can start with you if you don't mind.
Sure, no problem. The first thing I'd like to say is that I myself was hesitant, honestly, about getting vaccinated. I felt just like a lot of folks do that it was developed, felt like it was developed quickly. And so I was working from home, not really thinking about it. I said, I'll wait. I was one of those wait and see folks. And then the vaccination efforts rolled out, and we were tasked with working at these sites. And I said, well, now I'm thinking I'm going to be around thousands of people. Maybe I should. And the first day I worked there, I couldn't believe how many, because already, even before I had gotten to the vaccination site, I had heard from our folks, they're trying to kill us, this and that and the third. I barely saw us in these vaccination sites. White people were banging down the door to get in, coming after hours, like after we had closed, like, do you got any more? Everybody, 99% of the folks were white. And I thought to myself, they're not trying to kill us. If they are, they're doing a very bad job of it. And from day one, I was like, you know what? Give me this shot. And, and I obviously talked to folks and had questions, but, I just feel like this is our best shot at our best effort at getting out of this pandemic. So, yeah, and they're not, that was one thing I learned right away. All these white people were, like I said, banging down the door.
I did also raise as part of my own justification or to make myself feel better that I saw the rich white world trying to not only hoard it for its entire self, but if it got disseminated, it was for sale. So it wasn't being imposed throughout the rest of the world majority. So I admit that was part of my rationale as well. Joaquin, you want to jump in and give your perspective on it?
Yeah, it's good to see you. It's good to see everybody, by the way.
Yeah, right on.
So for me, New York City was one of the first major cities that was hit by COVID on this side of the water. We had already heard about the experience of COVID as it went through China, and then Italy touched on the West Coast in Washington, and then hit New York. And for myself, treating in most instances unsuccessfully, my fellow New Yorkers in my community. I live very close to where I work. What I saw was that we were against the virus, that in terms of medical treatment, we had very little answers for. And that led to more investigations of seeing, okay, so now we're developing kind of these prophylactic, let's say, treatments and vaccination, and maybe that's the way to go. And looking at the science behind it, the data behind it initially, and understanding also that we're in the middle of something that we've never been through. Maybe there can be some comparison in our generation to HIV/AIDS, where you have this thing emerge and you didn't have any kind of treatment for it in the moment, and all of this stuff is developing as it's killing hundreds and thousands of human beings. There had to be an alternative. And looking at the history of vaccines, not just adenovirus vaccines, and I'm sure Obi can get into it and other people can get into it, not just, vaccinations in the traditional way that we've been putting vaccines together, but then in terms of newer ways, and people like to use this word technologies, and sometimes that kind of scares folks off, but newer technologies and how to get our immune systems ramped up to recognize things that are foreign to us and then combat them. It was like, whoa, this stuff has been going on for a while. The research has been there, and now we're going to employ it in real time, in war, to try to save our community. Unfortunately, capitalism is an issue. And we could talk about that later. And I think that that's a real big issue when it comes to vaccine, our community's hesitation to mess with vaccines at this point. But I knew and I know that we have to do better, because I've buried enough Black and brown folks now as a critical care physician. This is the end of the line right here. Jonelle is the beginning of your hospitalization, and I'm usually the end of your hospitalization when it comes to severe COVID. And so looking at how little we had in terms of therapeutics, we had to be able to find and be open to some way of keeping us alive. And so that's where I said, we have to look at we have to look at the alternative for vaccinations, especially in the middle in what we call, it's not, we would want 10 years to run a randomized control trial, but that's not what we're doing right now. We have too many people who are still dying of this illness.
Obi, I'll go to you. How do you come to this conclusion?
Yes, sir. Yes, sir. First of all, thanks so much for having us. I'm really excited to be here and to talk about this. I live in New Orleans, just like my good friend and brother, Dr. Jonelle Daphnis. As he will tell you, the pandemic hit New Orleans and hit us really hard early last year, 2010. We had our local Mardi Gras celebration. We all had fun down here locally during that time. And then a few weeks after that, it really slammed and really hit us. And I saw a lot of death, as I think we all have. And I always point to what I would call the worst day of my career, where 4 patients of mine passed away. A few days after that, the same week, I had to comfort the wife of a patient of mine for many years who was dying, because we just really didn't have any options for him. And so that week was incredibly hard, as I'm sure it was hard for all medical people during this pandemic. Seeing so many people pass away. New Orleans is a predominantly Black city, and many of the people I saw pass away were Black. Many of the people I saw who were impacted indirectly economically were Black. A lot of our city's employment is in the hospitality sector, which completely shut down. A lot of people lost their livelihoods. A lot of people lost their insurance. And so I think the only real way that we're going to bring some closure to the pandemic will be with vaccines. We've been able to limit the spread of many other infectious diseases with vaccines. There are reasons why we don't see people dying of smallpox anymore. There are reasons why polio in most parts of the world, including very poor parts of the world, is no longer present anymore, causing problems. Measles doesn't kill people nearly as much as it used to. And I think vaccines really are going to be the way in which we'll bring this pandemic to some closure. There's been a lot of talk about how quickly the vaccines were developed. And, I'm happy to get into this in a little more detail later, but all the steps that are usually followed in vaccine development were followed, right from early, first off, making sure the vaccines are safe in animals, then to starting off with a small, limited number of volunteers, making sure it's safe and it does what it's supposed to do with the immune system, then going to an even larger amount of volunteers to make sure it's safe and it does what it's supposed to do. It's followed all these processes. And then on top of that, after the rollout, there's been so much scrutiny. Every potential side effect gets reported. Unfortunately, it gets sort of broadcast to the media, and sometimes the context is a little bit lost. But every side effect is being monitored. Everything is being checked as far as that. And we know that this vaccine is safe. I would say personally, the very first day it came to Louisiana, I volunteered to get it. I was really ready to get the vaccine. And certainly, obviously, I'm a little biased, but I really encourage everyone to consider the vaccine. Thank you.
And just quickly before we go to Janelle, I just want to let everybody know that if you have questions that you want us to get to, I'm going to ask that. Obviously, you can put them in the chat whenever you want, but I'm going to ask that you hold off for a few minutes and let us get through 1 or 2 rounds of questions real quick, and then tag me so I make sure to see the question, and then I'll bring it up. I'm going to try to do it that way if you all don't mind. Janelle, so Joaquin said normally hospitalization starts with you, but we're ending our first round of questions with you. So, but how do you come to this conclusion that vaccines are necessary?
I wanted to get out the realm of I think everybody talked about working in the hospital. I wanted to take the conversation home with my wife. We were both hesitant for good reason. I mean, we're Africans in America, right? And Africans in America encountering every institution in America. We have hesitancy in engaging them, right? Every institution. So the medical institution, the healthcare institution is not divorced from society. We all understand that, right? That without a doubt. So we, as Africans in America, were also hesitant, but we looked at the science. We had the skills, we have the understanding. It's our role within the community, right, to look at the science for everyone else, right? So in looking at the science and looking at and understanding it, it was so simple. It made sense. It was such a novel approach, but it was such a simple approach that I almost felt like I wish I thought of it, and it made complete sense. It was easy. So we were the first ones to get vaccinated, and I was the first one to get vaccinated in my hospital. And I also felt that it would, with me being the first one, I took the Pfizer. My wife ended up taking Moderna, so that we can show the community that it's okay. It's hearing all the stories. I was both connected to New York and New Orleans. All of my friends, all of my colleagues from residency, from public health, most of them are back in New York. And we were caught. Obi and I were caught here in New Orleans. We ended up being somehow we were connected to the 2 hotspots in 2 of the 3 hotspots in the United States at the beginning in March. And to hear the amount of morbidity and mortality inflicted on our community, the African bodies that were stacking up from nursing homes to the hallways in the emergency department to ICUs, to feel that we were, and this was before there was a vaccine. This was before we had any type of treatment. We're all shooting in the dark. All the doctors were trying to figure out what to do, how to do it. From those days to what we have today, everyone was searching for a silver bullet then, and we have it now. It's disheartening that Africans do not, in America, do not take it, take advantage of it. There are many things in this space that aren't to our benefit. But the vaccine, I see it as almost like collateral benefit. It's by chance that we have access to it. Most Africans, most people in this world don't have access, and we have access to it. And then a lot of us aren't engaging it. It's just
but isn't part of the reason, and you've already somewhat addressed it, Janelle, I think several of you, that there is and should be a healthy skepticism, particularly among our communities of this country's medical system, and particularly these companies that are involved in producing the vaccines. So, and even the statement involving Bill Gates, and his vaccine platform and position, which has been connected to reducing populations around the world, and then he does actually meet with Anthony Fauci. I mean, like these little things, like some of these bits and pieces are actually happening. Fauci is seemingly connected to the gain of function research that might be at the beginning of all of this. He's having meetings with Bill Gates. Bill Gates is trying to reduce populations around the world. The U.S. medical system has a history of abuse, and so on and so forth. I mean, so how do you all respond, or do you respond to all of that? After you've seen what you've seen, learned what you've learned, and engage in the practice as you do.
The question is, does the vaccine work? Right. This is where it comes.
I don't mean to, I don't want anybody to dismiss. I don't want anybody to mistake me as being demeaning. I can't help but laugh a little bit at that.
So my thing is, when I speak to my patients, when I'm one-on-one with my patients, and they'll bring up what concerns them. Is the vaccine safe or not? Is ultimately at the end of the sentence, right? I ask, how many people do you know died of COVID? How many people actually died of COVID that you think in the United States? How many people? Now, how many people died from vaccine? Let's say there were 5 people who died from vaccine that we don't know, right? Let's say there's 500 people who died from the vaccine. Let's say there's 5,000 people who died from the vaccine. How many people died from COVID? Like at the end of the day, science. You know what I mean? I'm sorry, Joaquin, go ahead.
No, you're right. I just want to, I've taken care of multiple ICUs filled with COVID patients. At this point, I haven't taken care of one single critical care patient who is in the ICU because of a vaccine. I've taken care of multiple ICUs full of COVID patients. And I think that that's really important, what Jonel's saying. It's one thing to say, that the vaccine kills. Okay. It's another thing to say COVID kills, because we definitely know COVID kills. And I think that there is a discussion here where, like when Jonel says, the question is, does the vaccine work? Right? There's that conversation, and we can have that conversation. And then there is a bigger conversation that we can all have about how capitalism has created the conditions where, we know what the vaccine, what their reasoning behind getting the United States vaccinated is about. They want people to get back to work. They want to get back their means of production, right? So they want folks to get back, start producing so that they can start making money again, because it does not help the capitalist bottom line to have a pandemic going on. We know what that's about. We know that they're not about getting Black and brown people through this pandemic because they're concerned about us. We know that. Nobody here on this panel is going to, I would think, is going to challenge that, right? I'm aware of that. I'm also aware that this vaccine has not been distributed to Black and brown countries. So there's a, it is purely in capitalist countries. Look, I mean, I know I know Black Power Media is a Pan-Africanist internationalist platform. And so what I ask viewers to do is think as an internationalist. Think as an internationalist, because we have to, I think that's the way to look at, sometimes gauge what's going on in the world when it comes to this vaccine. And like Jonelle says, the privilege, because it's interesting. We have the privilege to say no here. I spent 6.5 years in Cuba, right? You put an mRNA vaccine in Cuba right now, and they will line up all 11 million people to get a vaccine, right? But it's also different cultural values, right? There is a lot to unpack here where we're like, no, I don't trust authority. I never felt that when I was in Cuba. I knew that the government had, when it came to health, my best interest ever.
So that was sort of my point.
Up.
Like here, there's the trust levels aren't the same, justifiably so, between people here in the United States medical system and Cubans in the Cuban system. By the way, that is why I'm going to come back to that, but let let anybody else respond who would like to.
Well, I would.
Gina,
I would
go ahead.
Yeah, some of the points you were making, Jared, made me think of how many people in our community still say, HIV medications are killing us. They'll kill you, those medications. And we know, there are millions of people who are still alive and thriving. I know some very personally and that I'm close to that have had HIV since the early 80s, and they're healthier than me, because of these medications. So, I just feel like we have to also look at the proof and the data, and the proof is in the pudding. The other thing I'd like to add is that yes, of course, your state of health, your immune system is your first line of defense. So I'm not here to, disparage eating right, and taking care of yourself and exercising, etc. That's your first line of defense. But we have to use all of the tools that are available to us. That's what I wanted to add.
Okay. Obi, did you want to add to that?
Yes, sir. Yes, sir. I completely agree with what everyone is saying. I just wanted to also kind of just point out that I think everyone is aware that there have been abuses historically in terms of how research was done on people and marginalized populations. And because of that, a lot of things and processes have been put in place to independently monitor how vaccines or medications are developed. And again, this vaccine went through all those steps with independent monitoring by Black and brown people. They did actually create committees to advise on vaccine trials. I happen to have sat on one of those committees and attended to some of those meetings. And so a lot of processes were put in place to ensure that these things were safe. And again, even with the rollout, there's really a lot of vigilance in terms of monitoring to see not just is it safe, but is it actually doing what it's supposed to do, which is keep people safe, keep people from dying, keep people from getting extremely ill. And I think Dr. Daphnis and Dr. Morante and Ms. Arias kind of made really great points. A lot of times we hear in the media or people will say, well, my friend got the shot and da-da-da-da happened. You have to counter, what happens to people who get the vaccine versus what happens to people who actually get COVID. All the stuff about blood clots or about heart. If you look at the small numbers that happened over millions and millions of people who got the vaccines, versus I can tell you with COVID, you're more likely to have heart problems. You're more likely to get blood clots. You're more likely to have all those things, whatever it is that that you may have heard that's concerning as far as the vaccine in terms of side effects. You're talking about tiny numbers out of millions of people versus actually getting COVID, which could be relatively severe. Yes, being a healthy person certainly reduces your risk of having severe COVID, but it's really like a throw of the dice, because we do occasionally see young, presumably healthy people getting COVID and getting extremely ill. This current wave coming through New Orleans, younger group of people who are being hospitalized, as in younger, yeah, I don't see myself as being too old. So like, between the ages of 30 and 50, sort of, we're seeing more of those people getting hospitalized than we did previously. So just think about it. Think about your own self and your health in terms of getting the vaccine. Think about the people close to you. I thought very hard about my spouse and my mother-in-law who lives with me. My mother-in-law is older than us, has a few chronic medical problems, and I really did not want to potentially bring something, home, to her. So just keep all those things in mind and ask questions of people that you trust who have some medical training.
Obi, forgive me for interrupting, but you actually remind me of a question that I'm not always clear on. So what you just said, but you said you didn't want to bring something home that might negatively impact your mother-in-law. I thought vaccines don't prevent the transmission or even getting it or contracting it. They just reduce the impact of it. So are you suggesting that vaccines also reduce the actual transmission as well as the impact of it if you get it?
Absolutely. Okay. Vaccines do, first off, it reduces the likelihood of you getting it. And then if you do get it, it reduces the likelihood of you having bad symptoms. It also reduces the likelihood of you transmitting it. And so what we're seeing with this current wave down here in Louisiana is a big driver of the transmission right now are people who are not vaccinated. That's a huge driver of the transmission that we're seeing right now. It's a big driver of the hospitalizations. The health system I work for is one of the biggest in Louisiana, with multiple hospitals. Our hospitals are filling up. 95%, that's the data we have as of this week, 95% of all the patients we have hospitalized were not vaccinated. And so it's very, very clear that vaccines protect from getting severe COVID, keep you from getting sick enough to be hospitalized, and certainly keep you from dying.
Okay. I do want to reiterate to folks in the chat. I'm sorry, just real quick. I just want to reiterate, if folks want me to be sure to see a question to raise, please do tag me so it shows up brightly. Sorry, Janelle, go ahead.
No, it's okay. I wanted to put some numbers to what he just said. I'm in a small hospital, so I'm able to walk into my lab and get statistics, easy. Just speak to the guy. And, over the month of June, there were 153 COVID tests done. I'm in a very small hospital. 7 were positive. That's a 4.6 positivity rate. For the first 2 weeks of July, which corresponds with the rise of the Delta variant in our community, there were 115 tests done. Only 115 tests done. I mean, there were that many done, but 29 were positive. This is a 25% positivity rate. We're not this. I remember, I think it was about a month and a half or so, Joaquin and I were talking. He was like, Janelle, I'm worried. I am worried about this Delta variant. It's hitting my people right now in the Midwest hard. And I was like, yeah, I know it's coming, but that fear was founded. It's here. And my youngest patient, I just got my youngest COVID patient. She was 18 months old, Black girl. So this is when we're thinking about getting the vaccine, it's a personal choice, not only for our bodies, not only for us personally, but it's a personal choice for our community, right? Like we're warriors. I'm talking to the warriors. I'm talking to the intellectuals. I'm talking to the culturalists. When you say when I said I'm getting vaccinated, I said that for my daughter. I said that for your son. I said that for for the grandma, right? I said that for my mother-in-law. my mom who come to the house. Those are the reasons. I wasn't necessarily worried about me initially. I was worried about them, those who couldn't get vaccinated or those who had comorbidities, those who, if I passed it along to them as a physician, right, I was inflicting pain on my community. You understand? Yeah.
So just go ahead, Joaquin. Go ahead.
No, I mean, just I know we got plenty of time, so one of the things I think about is to kind of continue with Jonelle and the impact of COVID on our communities, and especially I just want to share this with the audience, right? So as a critical care doc, I have had to pronounce many fathers, mothers, grandmothers, grandfathers, uncles, aunts, dead from this virus. And every single time I have tried to communicate with families directly. I don't let the residents, they need to do that. But for me, as these folks who are under my care, I try to honor them by making sure that I was present in all family conversations, whether on the phone usually. But the impact for me on that is a whole generation of our community that has lost the wisdom and the guidance of their elders. And that is a tremendous weight and trauma to our community, to our people, right? That essentially we're going to have a whole generation that has lost that guidance, that has lost that love, that support. And that alone made me understand that I could not be a dogmatist when it was like no vaccine. I would never, because again, I'm sure that we all made sure to look at the data. And like, Jonelle and Obi said, the thing about being healthcare professionals is we're trained in that, right? We just like, you can go into PubMed or whatever, Jared, and look up whatever articles you're investigating. We have that training also. We can look at data and statistics. We're able to interpret data and statistics. That's a part of your medical training. And it's not easy. And there's several semesters of it. And you do it every single day so that you can understand what are good studies and what's garbage, right? And I had to make sure that I did that for myself before getting a vaccine. But it was especially important to do it because I was seeing in real time and a witness to what we have in store now, to the impact of this disease on us now, multi-generation wise. So I just wanted to pause there because I see in the live chat, people get real, this is a real contentious
I did want to
topic,
say I can't catch everything. I'm not moderating as much. Yeah, and I want to make sure everybody is being respectful. Like I don't want to add to the morass and the nonsense that's out here already. So one specific question that I did catch is or from several different folks is that specific to the issue of Delta, how effective are the existing vaccines? Where are you all on the issue of the boosters? Do they have any? And then how does one know specifically that you have Delta versus, I guess, regular COVID versus, I don't know. I hate to even say regular COVID, but anyway.
Yes, sir. No, that is a phenomenal question. That's a great question. So what we know is that the Delta variant is significantly more transmissible, meaning that it's easier to pass from person to person than the other variants of COVID that we've dealt with before. The vaccines are less effective at keeping people from catching the Delta variant, but they still protect people from getting extremely ill and dying from the Delta variant.
And so Obi, I'm sorry, is there one vaccine that's better than another in this equation as well? Is there one Does it matter which one you get? Sorry, go ahead. Yeah.
Yes, sir. That is a great question as well. So the information we have suggests that the mRNA vaccines may be a little bit better at preventing people from getting the Delta variant, but all of them seem to protect people from dying and from being hospitalized. And we have a lot of information from Israel where they used the Pfizer, which is an mRNA vaccine, and then from England, where they used the AstraZeneca, which is similar to the J&J that we have here in the U.S. And in both places, what they saw is people who've been vaccinated may still get COVID, but they tend to not get extremely ill to whereas they need to be hospitalized, and they tend to not die. So the long and short of it is vaccines still seem to protect against severe illness and death, even with the Delta variant. Now, you asked the question about boosters. As with the scientific process, things have to go through sort of being really studied to kind of know for sure. There is early information that at least with the Pfizer, getting a booster seems to, offer even more protection to the Delta variant. And I think we just heard news that Israel has automatically decided that amongst their most vulnerable people, so people older than the age of 60 and individuals with chronic illnesses, they're going to go ahead and start giving a booster with the Pfizer vaccine. But as with everything with the scientific process, we'll get more information about it. It'll be vetted. All the people on this panel here will look through that data thoroughly to make sure that that we all think it's good. There'll be a lot of physicians looking through it, and then eventually there'll be a formal recommendation as far as the getting a booster or not.
Because going back to where Gina and I started, I definitely want to ask: are the Israelis giving the vaccine to the Palestinians? Like that for me might solve the whole joint. Like, are they or are they not? Are they making the Palestinians go first, or are they not giving it to them at all? Like that. And I don't mean again to make fun of this stuff, but I mean I would be looking at that also. Like what's really going on, Anyway.
But you're 100% correct. There are vaccine inequities throughout the world. There are vaccine inequities throughout the world, and we should talk about that on this platform because looking at the people like, vaccines are poison. But we can have that conversation. I mean, okay, but also just the inequities that are unfolding and unraveling in front of us. I hope people maintain that same energy also when it comes to addressing those issues.
Did anyone else want to respond to anything so far before I raise another question?
I just want to say, these are all really good questions. And I think that I can only speak for myself here on this panel that these are some questions that I still have, I think I asked Jonelle not too long ago, should I get another one? I need to know, my concern now is, am I still being protected? I'm ready to take a booster right now. Now that said, I really am. Jonelle, am I lying?
He had to leave. He was laughing. He had to dip.
But that said, I don't even like to take a Tylenol when I have a headache. I worked years ago at an HIV clinic, and the doctor, who's also a very revolutionary doctor, he said to me, you should take the flu shot. I said, why would I take the flu shot? I've never taken the flu shot. And to be honest, I've never taken it since. He said, yeah, but you can get the flu, come in here and be fine. And you can kill people here because people's immune systems that you work with are not, to the same level as yours. That made logical sense to me. So I got the flu shot that year because I worked in an HIV clinic. So that speaks to some of the points that were made here before, Jonelle and Dr. Obi made. We're in community. We are, seeing our nieces and nephews who can't get it, some of them because of they're not of age, and our elders. Joaquin, you made a great point about so many of our elders that we've lost. I want to make a shout out. My partner's children just lost their grandfather, Mr. Dennis Terry in the Bronx, who was a pillar of the community, And, his grandchildren will not be able to listen to his stories anymore and learn from him. So I really urge us to think about our families as well.
Yeah, thank you for that. One question that I got here, is it true that unvaccinated folks can wear 2 masks and not spread or catch anything? Is it true that unvaccinated folks can wear 2 masks and not spread or catch anything? The effectiveness of 2 masks on unvaccinated folks.
Yes, sir. So wearing a mask certainly protects us from getting COVID. It also, if one has COVID, it decreases the likelihood of you spreading it. In general, there are different qualities of mask, if you will. The N95 masks, generally provide the most protection. Then there's the surgical masks, which are what's mostly sold when one goes to buy masks. Those also provide some protection, not as much as the N95s. And then the regular cloth masks, I've seen people just sort of pulling their t-shirts over their mouths and noses. That provides some protection, not as much as the surgical mask or the N95, which would be the most. But that certainly provides, some protection. I think some masking is better than none in terms of keeping yourself safe, from catching COVID, and certainly in terms of transmitting COVID. And so masks do work. I just want to say that, but I still would suggest I wouldn't mask as an alternative to getting the vaccine, because I think that the vaccine gives you that immune protection. So I would certainly get the vaccine, and then I would still wear a mask. And just it was a great point that Ms. Arias made in terms of duration of the vaccine's protection. We don't know for sure how long. I suspect, though, that COVID is going to be something where every year there'll be some type of variant, and we may be looking at getting boosters. That's just my suspicion. Again, we're still getting more information, and so we'll find out more. Thank you.
Right on.
Just
yeah, go ahead.
Yeah, just to talk to the issue of masking also, an N95 mask is a mask that needs to be worn properly, right? So, I used to have a beard down to here, getting my, because that's what we do, and COVID hit and that beard went away very quickly. Why? Because an N95 has to have a very tight seal around your face to be able to provide that 95%, let's say, it's able to filter out 95% of these particulates to make sure that you don't inhale any respiratory droplets that are out there, right? So that's one. So if you're gonna wear an N95, wear it properly, right? You can't wear an N95 that doesn't have a tight seal on your face. Two is that a double mask, yeah, they work, but I really want to just hammer home the point that it's kind of like the crudest way of saying it is it's like the difference between wearing some kind of barrier protection to make sure someone doesn't get pregnant or getting a vasectomy. We know that one is way more efficient than the other. So I don't shoot me. I'm just saying. So I mean, if it works, right? So but because that's the difference between having some kind of barrier protection. Barriers can always be overcome. You lose contiguity between something that and having that immune, we're talking about immune protection, ramping up the body's ability to be able to see things that are foreign to it and then attack them.
One question that I had that I wanted to raise is this issue of how we assess the medical advice we hear, whether it's seemingly coming from a medical professional on a YouTube video or in a live discussion like this, versus or a television, news conference, or even as I get sent to me all the time, seemingly very professional peer-reviewed journal articles that take all kinds of different positions on these issues, or seem to. For instance, like when I read academic journals in fields where I'm more comfortable and have a different level of proficiency, I'm more comfortable that I can assess the quality of the article. I'm more familiar with the debates, with the footnotes, with the references. But when I see some of these medical professional pieces, it may look, it may come in a peer-reviewed journal. It may have all of the trimmings and footnotings and look all But especially when they start throwing numbers around and formulas, I might go to the headline and it says, vaccines are, this vaccine is proven to be dangerous, or whatever the headline says, or this vaccine is great and we're all saved. But when I actually look at the material, I honestly don't know if I'm I don't know what the hell I'm looking at. I can't assess this. So just in general, how would you encourage lay people who get confronted with all of this, whether it's the TV people or the whoever, or even if someone is trying to assess you in this conversation, how would you all encourage people do that? Anybody, or all of you, anyone?
Yeah, that's a phenomenal question. I think one of the things that's been challenging during this pandemic is how quickly scientific information gets to the media. A lot of times things are coming out in press release prior to going through the peer reviewed process. Certain publication, and I think part of it is that there's, when pandemic came, there was a need for information about it. There was a need for knowledge. There was a need to get information out quickly. So a lot of research would come out. It would actually come out prior to being peer reviewed, and people would have access to it, and then it would go through the peer review process and then actually be formally published a few months later. And so a lot of information gets dumped out there. I think there are a lot of people with kind of ulterior motives in some ways, sometimes interpreting the information wrongly, or just simply spreading falsehood. I think one of the biggest frustrations I had last year was we had a president, presumably, a leader, the most powerful person in the country, who just consistently talked rubbish and complete garbage. And really, I think the damage from what he said and did is still being felt even today. I would have to say in terms of the pandemic. And so I think one, looking at who's speaking and seeing if they have some type of political reason for why they're speaking, it would certainly be, or some ulterior motive other than just simple healthcare for why they're speaking. Look at their experience. Are they people working, in the community? Are they people actually interacting with COVID? Are they people who are required to know about COVID as part of their professions? In order, so last year I think Dr. Phil, I don't know if people, unfortunately, I'm not saying unfortunately, but my wife watches that. Dr. Phil said some nonsense about COVID, and people listened to it. There was some other TV doctor. These are people who aren't working in the community, don't deal with COVID, aren't required to know about COVID as part of their jobs. Same thing. I know that there's a ophthalmologist.
I mean, is he even a non-medical doctor? I honestly don't even know. Never mind a medical doctor. I don't even know what his credentials are to be Dr. Phil on TV, much less talking about vaccines or medicine. But anyway, I'm
yes,
like,
sir. And
I was trying
know,
to keep it at least within the realm of people claiming to be medical professionals. You know
yes,
what I
sir.
mean? Like,
Yes, sir. So,
you know.
so for a great example, there's an ophthalmologist in our Senate who I don't think has practiced ophthalmology. He's an eye physician and, you know, has been consistently spreading false information. Again, look at his credentials. I would never argue with him about the eye, but when it comes to COVID, it's just not something that he has to know about as part of his job. And so he just doesn't know about it. And I think there were some viral videos between he and Dr. Fauci. I know there's a lot of people who don't trust Dr. Fauci. He's an infectious disease.
I mean, I don't trust Dr. Fauci. I got to be real with that, man. I think dude has been all over the place with this joint, and I think he's not a good actor in this either. Like, I don't like. There's a question I'm going to get to in a minute about people who are promoting vaccines, and I'm like, I don't know if I want you on my team. Like, I don't like. You know, and at this point, he would be one of them. But anyway, even with the CDC, like I have a hard time. Like they say, is to do this, that. I'm like, trust the CDC. So that's why Anyway, but I didn't mean to interrupt. Keep going.
Well, let me just wrap up with just one thing, and just to say that the thing with science is that when information changes, science modifies as new information comes out. And so COVID came out, we learned something. As we learn more, we modify it. So there's a difference between science and not to offend anyone, but like religion or politicians, because they just remain kind of stuck and remain stuck and remain stuck. Science, on the other hand, modifies. And so as one gets more information, one should modify. One should be very clear, hey, we had more data, we have more information. This is what we know now. And so things will modify. It doesn't mean that, oh man, this person is lying to me and he's been lying to me all along. It just means, oh man, this person learned more and is coming with new information as far as what he learned. Thank you.
Fair enough. But Obi said religion, so I'm not looking at the chat for a good 10, 15 minutes, just on GP, just because he said that. I'm just going to stay right here for like 15 minutes.
Even when
Go ahead, man.
Even when all things are perfect, let's say everything was perfect. You had sound leadership across the board saying, listen, we should get vaccinated. Here's the science. The science would change throughout the months, throughout the weeks, and that's normal. That's understandable, and so even when it's perfect, there's going to be movement. There should be movement. We're learning more. It's a novel disease, So I would expect some of the intellectual leaders in science to move back and forth. Where we are with mass, and then there's another difference. There's another thing that we need to consider. The three public health practitioners here, when it comes to the hard science of medicine and how we apply that medicine on a population-based level, right? We have to consider policy. We have to consider the politics of the space. We have to consider a number of different added layers of complexity that we just don't have if we're medical practitioners talking to our patients. All right. So when it comes to it's easier to talk about population-based mass mandates or vaccinate. It's easier for me to talk to my one patient than it is to talk to a population, because there's going to be differences along that population, so much more varied at the same time. That's it.
Right on. Did anybody have something before I raise another question real quick?
Just
to
get to this whole thing, again, I harp on capitalism. And I think American capitalism, we like 100% guarantee. In other words, if I buy something, it needs 100% guarantee to work, or I get to take it back and get my money back, right? And that's not how this works. That's just not, those values don't fit right into this space right here. Because statistically, right? So statistically, if you say 90% of the people who get this vaccine do not get admitted to the hospital with severe disease or die from this, that is an amazing number. If you said 80% of the people, 80 out of every 100 people who get infected with the disease do not have to go to the hospital with severe symptoms or die from this disease, from a medical standpoint, that's an amazing number, okay? Because I can tell you that I have many people, older people, there's something called immunosenescence, right? So the older we get, the weaker our immune system gets, right? So they can come in 75 years old with a simple pneumonia. I can throw all the antibiotics in the world at them. They don't have the ability to combat that infection, even with very good antibiotics, right? Because there's something called immunosenescence. As we get older, we transition back, right? Things stop working like they did in our youth, right? And we die, right? That doesn't mean that I'm going to stop giving antibiotics to people when they have an infection, right? I'm just trying to help you out in that moment, okay? But it's this capitalist values that we've decided that are going to be our own. If it ain't 100%, I ain't taking it. If it doesn't give me the guarantee where I get to take it back to the store and get all my money back or get something of high quality, I'm not taking it. You know what I'm saying? And that to me doesn't make any sense in this space, So I just raised that so we can also, think about what values we're bringing to this conversation or how our perspective when looking at what our actions are going to be in the middle of a pandemic with a virus that we've never seen before, that we're trying to adapt to, that we're in war in, right? This is not the Civil War. They line up over here, we line up over here, and we shoot each other with muskets. That's not how this works. This is high-functioning guerrilla warfare. So we need to adapt in the moment because this virus is also a living thing that also is adapting to us. That's what the difference is between the original strain that came out of Wuhan. Then we found another strain that we call the Italian variant, right? We've had multiple strains, which is the same virus adapting to become more virulent, to infect people easier. So that when we say that, there's this Brazilian variant, that was that same virus that has transformed and made some adaptations. It's adapted to try to then do its job, which is to infect and replicate. That's the job of a virus, to infect and replicate. So the one that was in Brazil, the one that's in South Africa, the one that's in the UK, the Delta variant, which is traced back to India, the original ones from March and January of last year, 2020, which were the Wuhan and the Italian variants, all of those are the same variant, just adapting. And we have to adapt at the same time. And that's what Obi is saying, that science is doing that, but it takes some time and you have to be able to sift out the garbage from true scientific, rigorous research, and that then gets disseminated to the population.
Riffing off of what Brother Jamil raised on the enticements to get people vaccinated, de Blasio in New York with the burgers and fries, Manny Fresh and them with the and Boosie with the free beer and pizza, and then they had the vax that ass up with what's his name, do you all have any thoughts on that? Do you
listen. There's going to be. I look at it this way. There's so many different types of people, and you're going to have people that like Sister Gina said at the beginning. There were people who lined up the first day the vaccine was available. People who didn't qualify, who wanted to be there, who got in line, right? They're going to be those people that you don't need to say anything to, right? Then they're going to be people, as you go along, they drop out, then there's going to be those who are less hesitant, more hesitant, and then there are going to be those who just will never do, And so, mixing up these, at the end of the day, the important thing for me is that people, our people especially, who are getting hit on another, disproportionately, that we find a way to get vaccinated, right? So if it works, but mixing up these messages with it's at the end of the day, if we get people vaccinated, that's the most important thing for them.
This would be the thing I would even consider getting on board with. Don't offer me burgers and fries, offer me universal health care. And if you say, like, we have universal health care, get vaccinated. Like if you said, like, if the country hits 80% vaccination or whatever, the 90% vaccination, we all get health care, then I would be out there like even more like, let's go. Like, that's an enticement. A burger and some fries. I mean, I'm saying pay off my student loan debt. I'm just something like, let's get serious. Anyway, go ahead. Anybody want? But seriously, like in general, I would even want to hear you all riff on or talk about this. Like, what if we had universal health care going into this crisis? Where would we be, and what difference would that have made?
Well, we don't have a healthcare system, right? There's no system here. This is private, public, mostly private, deciding what's going to serve their bottom line and how to sell you healthcare, not how to provide health to communities. I want to also always make sure that nobody here is saying that, we don't want our communities to be healthy, to eat well, to take your vitamins. Take your vitamins. You know what I mean? Nobody's saying don't take your vitamins. Take your vitamins. Eat well, eat healthy, exercise, do all of those things so that you can preserve your health. Right? No one is saying that, because that's keeping people healthy, and prevention is the most important. Nobody on this panel is putting vaccines above that, because there's two different conversations happening if we're talking about that. The system that we have that provides healthcare is a broken one. It's not a system at all. Its number one priority is not to keep us healthy. You're talking to someone who had the privilege to actually live in a place that provides healthcare to all of its population, to walk into any kind of to any primary doctor's office at any time of the day without an appointment and say, hey, I'm feeling X, Y, and Z, and care would be provided, all right? Or some consultation would be provided. Not a dime of money had to come out of my pocket, nothing. It was just a resource. It was a resource to the community, right? And that's why when I talk to my Cuban counterparts, over there, they're like, oh yeah, today's my day to get a vaccine. I'm getting my vaccine. No one has said, and I talk to a lot of people, who I maintain my relationships with, who are my friends. No one's like, I think I'm going to skip this one. I'm going to skip this one.
But again,
I'm
isn't that because they're getting the Cuban one? But isn't that because they're getting the Cuban one versus?
So the Cuban vaccine is an adenovirus vaccine, which uses the same technology that J&J and AstraZeneca is using. It's basically the same. So it's a vaccine using more traditional ways of delivering the message to the body to ramp up its immune system. You just put Cuba on, okay? That's all. They didn't reinvent the wheel on this one. What they did is, because there's an economic blockade against Cuba and that they have to be self-reliant, is that they had to make their own vaccine, right? Because they can't go and purchase a vaccine on the open market. And Cuba has always been resourceful, and Cuba always puts the priority of its people when it comes to health. A country that doesn't have two nickels to rub together at this point said it's important enough for us to prioritize the development of vaccine. There's very few countries in the developing world that can do that, can say that they've done that, right? Think about that. So that's just my Cuba. That's my shout out to the Cubans, right? But people over there also understand that this is part of healthcare, is that vaccination and prevention of infectious disease is a part of healthcare's job of keeping people safe. Anyway, that's...
So essentially what Joaquin just touched upon, Brother Joaquin, is that the relationship that the Cuban people have with their medical system, their institution, is not fraught with, it's not poisoned, by, the history that America has with our population, right? Like the relationship that Africans in America, that brown and black people have with the institution, this American institution, is fraught and poisoned from conception. That's not something that the Cubans have. But the one thing that's held equal, right, is that the vaccines, work. But because the relationship that the Cubans have with their medical system is not poisoned, they trust it. But because we don't trust American institutions, we Jedi mind trick ourselves not to have faith in that vaccine also. Although from the experts that you trust, right here in front of us, we all look at the science and believe in it and understand it and feel it and see the result of it. That's my thing.
Did anybody else want to add anything? I'm just hesitant to unmute because all of a sudden everybody needed to fix everything on our street outside right now. So I feel like it's real loud out here. But did anybody want to add anything? All right. Actually, I've asked all my questions. I did want to talk. The only thing I had left was to talk more about the specifics of the Cuban medical program and all that. But yeah, go ahead. Go ahead.
So, because a lot of people I see on the chat, and there's some trolls on this chat. Oh,
I know. I'm not even seeing it, but I'm sure they're there. Yeah.
Blessings upon y'all. You know what I'm saying? I'm just trying to give the information that I have available in my humble, day to day. I'm sorry if I offend anybody on that chat. So the way that vaccine monitoring of side effects is performed is there's a passive and an active surveillance, because it looks like there is a little bit of confusion on this chat. Obi, please correct me if I'm wrong. So the passive is that anybody who gets a vaccine can log on to a website and say, I was vaccinated, and provide their symptoms, and that goes into a database. That database that information is then corroborated by CDC, it's the FDA, I think, that information goes into. Obi, that's where I'm not sure. The active surveillance is that the FDA actually follows up, follows up with people who have been vaccinated, and then follows them for some time to see if they have had any secondary or ill effects from the vaccine. The passive, you can imagine, if anybody can log on, the amount of information dumped into there is like boom, and then they have to sift through it, because the reality of the world is anybody could just get up on there, right? So if anybody could just, had your phone number, Jared, and you're on I Mix What I Like on a Friday, do you know what your text messaging would look like? It'd be crazy, and that's
it would look like the chat room right now.
Exactly, and that's what the passive surveillance is. So that's a ton of information that needs to then be sifted through and then verified. So sometimes when folks say, "Oh, where's the info?" Well, it is somewhere. It's being worked on, and then it gets disseminated out. So the latest that I saw in terms of like just listening to some folks. For blood clots, they say about 4 to 7 people per million have gotten blood clots, right? Believed to be from the vaccine, right? As a secondary
4 to 7 people
per million.
Per million? Not
per
4
million.
to 7,000 or 100. Actually, it's just 4
to 7 per million.
Wow.
4 to 7 per million, because this is the whole thing. 4 to 7 per million. That would be the incidence rate. So if every million people who have been vaccinated, 4 to 7 may develop blood clots or have developed blood clots, okay? That's about the same as what I see in the hospital from people who are not vaccinated. Just
But you
folks who
scientists
are
need to
sitting
do
in,
better.
just from truck drivers who have to, who work in a sedentary job, or people who travel transatlantic flights who just sit on a plane and there's stasis, in other words, their blood doesn't move from their legs up and then form clots, and then that goes maybe to their lung. For anaphylaxis, 2 to 5 per million. Myocarditis is a little higher, 20 per million. Guillain-Barré syndrome, which is an ascending paralysis that we see in many, that is secondary to many viral illnesses, is about the chance of that is 0. And this is more associated with the J&J vaccine, 0.0008%. 0.0008%. So these are these risks of the vaccine are not very high when you look at it in perspective. Now, the risk of dying from COVID is much higher.
But what about the whole argument about, even this one I forgot to ask, what about the whole argument about, well, A, we don't know what the effect will be long term. And then there's this argument that it's literally changing our DNA, and that this will have onto our ancestors or our descendants, rather, it will have a lasting negative impact.
That's a great question. That's a phenomenal question, by the way, and it's a very important concern. I just want to answer it in a couple of ways. One, the vaccine does not alter a person's DNA. What the vaccine does is that it gets into the body, it basically stimulates your immune system, and then it completely vanishes. It basically goes away. So it doesn't stay in our body it doesn't really stay in our body for that long, to be honest with you. We inject it, it stimulates the immune system, boom, the immune system gets rid of it, it's gone. And then the immune system builds a memory, so that if the immune system sees anything that looks like the vaccine or looks like the virus or mimics the virus in any way, the immune system, that memory that the immune system has, immediately ramps up quick and gets rid of it. And that's how the protection ultimately happens. But I just want to be very clear that it's not in any way altering one's DNA. The actual vaccine vanishes, and then we have that immune memory that kind of stays with us and gives us some protection. And then the second point was, will there be some long-term effects like 5 years, 10 years down the line? And what we know about the immune system and vaccines is that no, basically. The way the immune system works, you have, and particularly with vaccines, you have that response. If there's going to be any side effect or adverse effect, it generally happens within the first 2 months. So all the things that Dr. Morante talked about, the way the immune system works, if something is going to happen, it'll happen within those first 2 months. And so if you're out 2 months, don't blame, your headache, 6 months after the vaccine, to the vaccine. No, the way the immune system works, it'll happen right quickly if you're going to have some type of side effect, which, as Dr. Morante so eloquently stated, is we have some minor side effects that are not very common. So again, I don't have any ulterior motive. I glanced at the chat box a little bit. I don't have any ulterior motive for suggesting that people get the vaccine, other than the fact that I've seen way too many people that look like me dying. I have seen way too many people that look like me losing their jobs. I've seen way too many people like me crying because they feel like they passed COVID on to a loved one that subsequently died. And it's so important to me to come to these forums to speak. I'm always excited to do that. I just want to touch on a little bit the point about using burgers and fries. And I'm from New Orleans, where Juvenile is from, and came up with that. Well, I live in New Orleans. I'm not originally from here. I just want to say that I think however which way we can get the message out, as Dr. Daphnis mentioned, I think the message should be gone. I think part of it, yes, there are people who are hesitant, and yes, a lot of us don't trust the system. But there are people who do want the vaccines and really truly just don't have the right access or really know how to get it. And I think in any which way that we can get the information out and get people better access to the vaccine, I'm it sounds very weird. I think some of the things that are being offered, but I don't have any issues with it.
Yeah, I agree. Actually, De Blasio is now offering, I think, $100, and I'm like, I want to try to go back and get my booster, get my $100. But what I really wanted to build on is what you said, Joaquin, about the monitoring of the side effects. Because when I just want to speak from my own experience, when I had my second shot, I did sign up for the app, register myself, and I was getting texts every couple of hours from, whatever entity is monitoring these, the side effects. And I was putting in, I did get a slight fever. One of the things the app says is that they may contact you if need be. And I was honestly, because I was here by myself, I was honestly hoping someone would contact me, because I had a fever of like 99 and, I was uncomfortable, but nobody contacted me. But that monitoring didn't stop until I asked the app to stop texting me, until I shut it off. So it's very rigorous, I would say, just the data collection, just to mimic what you were saying, Joaquin. And the other thing that has come up here is about the chat. I can't see the chat. I would love to hear what is going on in the chat and pull some questions from, the audience.
Well, I've been trying. So part of it is, and I'm let me go ahead and welcome Brother Kaba, who usually co-hosts with me on Fridays to the show. On the one hand, so I've been asking people to tag me in the chat if they have a specific question, so that I'm sure to see it. And I haven't seen that in a while. There's a lot of nonsense in the chat, and I'm a little disappointed. I'm not going to front. In that it would be one thing to disagree with a guest. It's another thing to raise questions about why that they're saying what they're saying. It's also, I think, disingenuous to say a bunch of nonsense on this platform when this space should be, we should understand differently how we get down over here. So that part is disappointing. Rigorous debate is one thing. Raising questions is great. But some of this is just nonsense, Gina. So
don't be
level, I think you should be fortunate.
Don't be disappointed. Don't be disappointed. We've learned some bad habits from the Americans. You know what I'm saying? From what I really want to say. But we've learned some real bad habits from these folks. About what it is to talk amongst community. And
Franny French, I see you. I'm hoping that we're trying to debunk some of the myths in the chat. I'm just trying to, but what I was hoping for was that people would actually raise their questions in a way that I could be sure to see them without disrespect or hostility. And that's the part I'm not seeing. So if there are questions that I haven't raised that need to be raised, that we're all happy to do that. Yeah, sorry, go ahead, Obi.
No, I just wanted to say I do have to exit, unfortunately.
Okay.
I'm being called into the clinic, but I'm happy to come back anytime to answer questions.
I'm happy to do this again. I really appreciate you coming through. Thank you very much, Dr. Nnedu, and we look forward to hearing from you again, man. Thank you very much. Peace.
Thank you, brother.
Peace, Obi.
Yes, indeed. So, by the way, it is 9:30. We're not set to any hard time, but just time check. If anybody needs to make any concluding comments or anything, please let me know. As I said, Brother Kaba, welcome to the show. I don't know if you have any particular questions that you wanted to make sure you had answered related to this issue before we got out of here. Or if either of the three of you remaining have anything specifically you wanted to say that I haven't raised, and then I'll glance back over here to see if I can find something to raise for you.
I could talk a little bit. Just from Jonah, were you going to say something, brother?
No, go ahead, brother. I'll say it after you.
I just real quick, because I do see a lot of questions about therapeutics. That I've seen the words ivermectin there. So as it stands right now, the only large trial where there was shown to be any benefit for severe COVID was something called the recovery trial. Recovery trial was where we gave a steroid, right, to try to reduce inflammation in patients. And there was some mortality benefit. In other words, fewer people who received the steroid died than people who did not receive the steroid. In terms of ivermectin, there haven't been any large randomized controlled trials. This recovery was a large randomized controlled trial. That means that the doctors don't know who's getting one and who's getting the other treatment, the intervention, and people are sorted out in a way where things are even amongst them. There have been no large randomized controlled trials for ivermectin. Again, we're in the middle of the pandemic, and there's research on ivermectin, because ivermectin is like the therapeutic du jour that I've heard of. Matter of fact, one of the big ivermectin studies that was being referenced actually had to be pulled because the authors had to admit that their research was actually faulty. And so that was a big blow to the ivermectin group, because again, these are human beings who are also trying to make I don't have anything to sell. So, I'm not in that camp, but there's human beings that are, they make a name off of their research and what they say. Jared, you know about that, because that's the same world of academics, right? And so, and you debate them, you look at the research rigorously, and you say, hey, Dr. Marable, I don't think that your research was sound,
and yet people still believe them.
And yet people still believe them. So, so the ivermectin thing is still out there. Yes, we know ivermectin is an anti-parasitic. It kills parasites. Hasn't been really researched in viral illness. It's two different things. There's nothing really been proven on that. There have been some other bigger studies looking at vitamin D, thiamine, vitamin C. There's a physician out there by the name of Paul Marik who's tried to treat vitamin C for everything, sepsis, and he has a big name. He started to push the vitamin C thing. Again, no mortality benefit, no morbidity benefit in trials that have been rigorously looked at. There's not much in terms of therapeutics. There's not, and I work in an academic center where, many trials were being run, especially at the height of the pandemic here in New York City. We were giving convalescent plasma to people, interleukin-6 inhibitors, which also work on the immune system and help to decrease inflammation. None of them were being shown to have serious benefit on patients. There is some data right now that some of the IL-6 inhibitors may stop you from getting intubated. I think, things they'll sort themselves out with time. Again, all of this is happening in real time. But what we do know, just from looking, there is a big randomized control trial that is happening right now between people who have gotten vaccinated and people who have not gotten vaccinated, right? And the big and I can tell you that looking at the data right now, it's like Obi says, 95% of the people who are being hospitalized are not vaccinated, not anti-vaxxers, I'm sorry, they're not vaccinated. And 99% of the deaths are people who have not been vaccinated. And that is the natural randomized control trial that is happening right now at this moment. And some of the interesting stuff, and I'll shut up after this, is looking at data, especially out of the UK, because the UK has the National Health Service. So they have a nationalized health registry. And if you look at the data from the UK right now, if you compare kind of the amount of deaths in January when they got hit with that UK variant and they didn't have vaccinations going up, they were saying, this is the data right here. In those greater than 50, around 39 individuals per 10,000 were dying, as opposed to 2.1. Now that they have, it's almost 90% of their adults who are 65 and older are fully vaccinated. 2 deaths per 10 million. So they went from 40 to 2, and they're getting hit with the same amount of infections. And that goes to what Obi was talking about before. The data about these vaccines, when they were approved, were in their ability to prevent severe disease and death. It was not studied for asymptomatic infection. What they were looking at was symptomatic infection and death. So that's a really important point when it comes to these particular vaccines, is what they were studied for. The results are actually playing themselves out right now. They were studied to prevent severe disease and death. And that's why they got emergency use approval, because they said, listen, this thing is doing what it's supposed to do. And it's actually it's actually doing that in real time around the world, in these capitalist worlds that have the vaccine to distribute to their populations. And what is it doing? It's killing Africa. Namibia is on fire. Zaire is on Zimbabwe. All these countries where the deaths are exponential right now because they have no access to anything. And so, it's really important to understand why these things were given EUA approval. The other question, I wish Obi was here because I saw, is like, why haven't they gotten FDA approval? FDA approval takes years and years and years. And when you're in the middle of a pandemic, we really just had to use the data that was looked at. Again, these vaccines, the technology has been looked at over 10 years. 10 years. So this wasn't like the mRNA vaccines were created yesterday or in January of 2020 or December 2019. No, it was 2009. So these things so the technology has been there. What they did was they said, this is the time to implement it on this specific virus. And it really has worked.
And the only reason why it wasn't implemented 10 years ago is because the companies didn't feel that vaccines make money. So it's not that it didn't work. That by far, that wasn't the reason.
There was just no financial incentive.
Exactly. So these are capitalism. It's capitalism. Now we have.
Let me raise. Sorry, go ahead.
No. I think I'm going to leave soon, but I wanted to. I think we've done a wonderful job of showing.
But that's why, Janelle, I'm sorry. Let me raise these last few issues before you leave, so you can maybe fold a response into any last response, before you go, because there are a couple questions that we haven't got. Just quickly, there's questions about what is in these vaccines. I think some of that has been addressed, including a question about which variants will become irrelevant, At what point will the variations of the virus make these vaccines irrelevant? I think somewhat that has been answered, but please come back to that if you like. But there is one specific question about what's in the Pfizer vaccine. Some claim that there is graphene oxide, so if you want to talk anything about what's in these vaccines, I think you've already done that, but please. But then there's also a question about is COVID more like the influenza virus than polio and measles? I ask because MMR and polio have been eradicated, but influenza has not. And then the last question that I'll throw out there is about kids going back to school. How do you all feel about it? Where are we with what age kids are vaccinated, and what is the effectiveness of this? So Janelle, I know you said you're about to have it to go, so if you could deal with any or all of that, and I'll repeat anything if you like, but please go ahead. Yeah.
About kids, I specifically wanted to bring a human face, and I was going to use a kid's face. I wanted to circle back to why we want you to get vaccinated. Is it all right if I just tell them a story about one of my patients? About 10 days ago, I looked at her white berets, barrettes and her braids, and a fleeting thought of how they would look in my daughter's hair crossed my mind. She was 3 years old. 25 minutes ago, she was under her grandmother's care at home, on a couch playing with 3 other of her family members. They said she fell asleep. 5 minutes later, her grandmother tried to awaken her and couldn't, and started mouth-to-mouth resuscitation, while also activating EMS. The firefighters arrived within 5 minutes and found the child gasping for air and scooped her up immediately And their worst fears were realized when she stopped breathing along the way to the hospital. They started CPR. The first time I saw her is when I ran to the emergency department hallway after hearing frantic banging at the ambulance bay door. She looked like a floppy, oversized doll in the hulking fireman's arms. He was both carrying her and attempting CPR. We immediately placed her in the bed and started resuscitating her. She didn't have a pulse. She wasn't breathing. We started to give her oxygen with a bag, that pushed air through with the mask, and then I decided to intubate her immediately, sticking a tube down her throat and connecting her to a ventilator, so that we can take away the work of breathing. Simultaneously, we screwed 2 IVs into her lower leg to help administer medications directly into her circulatory system. We gave her drugs to help her pulse return. I called her grandmother to the bedside to find out what's going on, what happened. She said that this 3-year-old girl was diagnosed with COVID earlier in the coming prior weeks. I called for a stat bedside x-ray after intubating her and found out the left side of her lung was completely whited out, filled with infection. I guided all this while looking at her white berets and her hair, wondering if it would look good in my daughter's hair. This is why we're doing this. Forget all the bullshit. We see people dying. We see our people dying. It's not anybody. Most of my patients are Black people. We're fucking around saying, "Oh, this shit isn't working. There's additive. This shit works." And we're just tired of it. We're tired of seeing our people die. That's the reason why we want this. We're fighting for us. We chose this route. We chose this route in revolution. We chose medicine. This was we chose the medicine bag over the AK. You guys entrusted us with the medicine bag. Trust us now. We gave our body to the vaccine also first to show you that we would want to do this, that we would want you to do this. I don't want another 3-year-old to die. That's the reason why we're doing this. Hey, I love you guys. Thank you for letting us on.
Love you too, man.
Love you, brother.
Anytime, man. Man, take care of yourself, my man. Be safe, man. Thank you for coming on and saying all that, man. Peace.
Yeah, Jared, I also have to jump off.
Sure.
I trust Jonelle with my life. And I just hope that people really heed not only what he said, but everybody here with your personal experiences with patients. And I'll come back anytime you like. Thank you.
No, we'll definitely have you back. Appreciate you coming through. Thank you very much.
Peace.
Take care of yourself. Peace. Wow. Man.
Well, can you hear me?
Yeah, brother, go ahead, man. Yeah. Go ahead.
Yes. So my apologies. I think we got our wires crossed there a little bit. So I wasn't sure if I was going to be on today because I knew you had several folks on.
You being polite. It was probably my fault, and I apologize.
Well, it's, communication is 2 ways. But very powerful discussion. I wish that I had been on for most of it. I did catch quite a bit of it because I have quite a few questions myself. But and of course the last contribution was very powerful. Of course, personal stories are always quite powerful. I did want to ask because the question about the number of people who actually contract the disease versus the people that actually die percentage-wise, and I just wanted to just ask what that was, the official numbers.
Yeah. So you're right when they talk about, it could be 2% on a global scale, right? But what you're taking is young people, middle age, and older. When you look at older individuals, the number is much, much higher. And that's why the initial push was to vaccinate those people 65 and older. And what have we seen? That those people 65 and older are actually dying much less than they were previously, even if they get infected after being vaccinated, right? And that goes back to this original point that I talked about, which is called immunosenescence, which is that our immune system becomes weaker as we get older and is less able to fight off infection. And so, being kind of analogous to like when people say, oh, this is like the flu. So the flu tends to actually kill older people, right? And that's why there's always a big push every year to vaccinate older individuals for the influenza virus. So when you look at the total in aggregate, it looks like the numbers are much lower. But then when you look at our elders were the ones who were dying of this disease. Okay, so getting back to that data from the National Health System in the UK, 40, right? So in the second wave there, 40 of every 10,000. Now it's 2. But I always say to people, as Black and brown people, I was always told, respect your elders. And if you're willing to play with their life, like, oh, it's 2%, it's no big deal, well, then you've taken on values that I can't agree with. Where then you've taken on values where you've stopped to care, you have stopped caring for your elders. And I'm sorry if that offends some people, because I'm here. I need their wisdom. I need that guidance. I want my children to have that guidance. They have raised us in community. And if we don't go and do everything to protect them, then that becomes an issue. It's only, if you even notice here in the United States, it's only when it started to affect people in the 30 to 40 range with the Delta variant, which is now affecting younger people, that it was like, oh, wait a minute. This is an issue. This is more of an issue. And so that goes to that number of mortality. Another thing that, so that's that.
Yeah, well, I know that there are some people too who say that also in terms of immune systems with elders, that it's not necessary that their immune systems will definitely be compromised just by being older. I think you all spoke to lifestyle choices as well, and I think that there have been several folks who've made those kinds of changes, and I think maybe that could be a way to maybe prevent us even being susceptible to a lot of the things that they're susceptible to, and including the pharmaceuticals. I did want to ask too about Johnson & Johnson. They've had some issues, of course, with their vaccine, not only the vaccine, but also the talcum powder, and then they also had some sunscreen issues. And it may raise some issues with some people in terms, and you talked a lot about capitalism and the profit margin, as to why Johnson & Johnson is still allowed to even operate. I think a lot of people are just saying that in general, whether there's a pandemic or not, but particularly when it comes to the vaccine. But I wanted to know just that as a general question, and then also, what's your opinion of the Johnson & Johnson vaccine?
I mean, fuck Johnson & Johnson. I'm Puerto Rican. You know what I mean? Fuck Johnson & Johnson, right? So that's my opinion of Johnson & Johnson. Now, my opinion of Johnson & Johnson vaccine is that it has been shown, people are like getting on me, oh, he's talking to the pharmaceutical companies, profit margin. It has been shown to reduce severe disease and death. Not as effective as the mRNA vaccines, the Pfizer and Moderna, but it has been shown. How do I feel about Johnson & Johnson? How do I feel about Pfizer? How do I feel about AstraZeneca? How do I feel about Moderna? I think it gets back to Jonel's. None of those, the mRNA technologies were being used as vaccines because they didn't make any money. And now they found something that they can implement technology that they were holding, use it to make money. And of course, they put it into effect. Nobody's arguing with that. Nobody is arguing with that. But at the same time, let me tell you, it's funny. This thing is, I'm going to jump off the initial question just to put things in perspective. We're broadcasting on YouTube. YouTube is owned by Google. Google tracks everything. You tell me to like and subscribe. Are you telling me that I should be tracked by Google? Are you an agent of Google and of the higher powers? Because that's what I think you are then, because you're telling me like and subscribe. I like and subscribe. My data gets put up to Google. Google now owns me. That doesn't sound, it's plausible, but is it reality, right? Are you an agent of so this is like where I'm like, wait, hold on.
Except that's not going to have an effect on your direct health. I get your point. I mean,
But Kaba, this is something.
the phones,
but
etc.
hold on real quick though, because this is something that because I know our time is coming to an end, but this is a point that was discussed, and that the point is, does the vaccine work? And it's not a question of the politics of the people putting it together or the state whatever. It's a question of, do the vaccines work? And what we've been hearing is unequivocally the answer is yes.
But the vaccines have been around for a short period of time, and so we don't know the long.
Again,
let me just finish the point. Now I'll let you finish. So, but we don't know the long-term implications. And then that also raises questions when, in fact,
but brother, that was already, that's my point, but that was addressed, and the doctor said we would have already known what the effect is, because you learn what the effect is within the first 2 months. So they generally speaking, but
already
been answered.
But generally speaking, but we don't know that in this particular case. I did want to say too.
But wait, I can't let that ride, because we just heard, but they already said, they've already laid out that all of the steps that would be normally taken to process a vaccine have been taken with this. All of the trials, all of the care that would normally go into it. So
then why is it not FDA approved?
Oh, so that's a good question.
That was already answered, but okay, go ahead.
Yeah, brother Kabal. Oh, I see where you're coming from. Okay.
Right.
So the thing about FDA approval is FDA approval for when you're using something for a specific use, right? Mm-hmm. They have to go, the FDA in particular has to go through every single case where you would think that there was an adverse event. That could take up to 4 to 5 years.
Okay.
Looking at the safety of mRNA technology has been going on now. It's just like Brother Obi said. First, they went to animal models, then they went to small human trial, then they went to larger volunteer trial. All of that has already been done. So the safety profile has been going on for a long time now. It didn't just happen yesterday. Okay. Now the FDA approval is like, they can't put a rubber, I think, bureaucratic wise, they can't just put a rubber stamp on it. So what they did was they went through emergency use approval for these vaccines to be able to disseminate them out and to distribute them into the community. So if you're going to wait for the FDA approval, that's going to take a long time, because that is more of a data mining thing where you have to, there's protocols to that. Okay. Is there data on the safety and efficacy of the vaccines beyond December of 2019? Yeah, it's now greater than that. It's 10 years into now. So I think that's the perspective that at least scientists who are tracking this. And again, when you say, sometimes my pushback to people are like, oh, I don't know, and I'm always like, but you weren't shooting with me in the gym. This is all I do. I eat this, I sleep it, because I have a responsibility to take care of others. You know what I'm saying? And so generally with vaccines and the long-term implications, what happens is long-term is actually very short-term, because your immune system sees something and will generally have a reaction that's quick, very quick. So you see things within 2 months. And we're talking about hundreds of millions of people now. You don't even get randomized control trials with the amount of people who have been vaccinated. If with this amount of people, you would have seen something. You have seen something. Usually a trial has like 4,000 people in it.
Yeah,
right?
but
we have hundreds of millions of people.
But there have been But I get the point, and I appreciate that. But there have been contraindications. And in various cases, there are people who have reported contraindications who have taken the vaccine, and they've actually been called anti-vax. As a matter of fact, one of the people, Brother Jared, is Jimmy Dore. He himself just recently talked about the fact that he took that and there were contraindications. And that leads to my next point about the fact that there's no liability with these vaccines as well for those people who have experienced contraindications, and up to the fact that there have been people who have died. And I understand that that's the small number, but that also goes to my point, the first question that I raised in terms of the fact that the majority of the people, 99.6% of the people, according to the official statistics, who get the disease actually survive. So I just wanted to just make that point as well.
So I would wish that you would come into my ICU and then look somebody in the eye. No. Because I'm going to push back on that. Because that right there, when I hear that, I say, where are we going? What are we doing?
You can say the same thing for the people that took the vaccine and died from it, though. You can say the same thing.
Hold on 1 second. Before you respond,
we're talking about 600,000 just in the U.S. alone. 600,000 people who have died of COVID.
Which is a small number compared to the people who actually. I get it, because I know people. Listen, let me just say this. I know people who have died from. I know people who have died from this vaccine. So I'm not minimizing it at all.
From the vaccine?
Not the vaccine. I'm sorry, but no, not the vaccine. I'm sorry. I correct myself. From COVID, I know people. I know people who've gotten sick, and I know people who have died. But my point overall is that, for the most part, just like in the point that you're making, that you're seeing these people. So I understand that, but I also understand that there's also a number of people who have gotten the vaccine and who have died from it. And we can say the same thing, because you can say, well, that's a small number. You're saying the same point. That's a small number too. But to those people, but to the families of those people, there's several. I have several articles of people who have died.
This is the problem I'm having right now, and this is in part. I want to accept responsibility for this. This is in part my fault, because I didn't communicate to get you on at the beginning. I want to accept responsibility. But what I don't think is fair right now is that after we've listened to 2 hours of experts laying out all of the information that would explain all of these questions to you, to then come back and do it again and to offer as a false equivalence.
I don't think it's a false equivalent, but I agree with your point.
No, I agree with your false. Kabat, on its face, it has to be a false equivalence to bring in an anecdotal response.
They're not going to be any trials, brother. They're not going to be any official. The pharmaceuticals are not going to give an official trial or research.
You're not letting me even finish my point. On its face, it is an unfair. It's not a fair. Now lost even the word. It's not a justified parallel.
I get your point.
Because you're bringing an anecdotal singular response in the face of 2 hours of expert explanation. So on its face, it's just not an equal. So I would ask that you first go back and listen to what they've said. I would say the same thing to anybody in the audience. We've already said we will come back to.
Can I just make a?
But you're saying, but they've already outlined. They've already answered all of this.
But my point about. Let me just say this about the trial, and I respect that. But what I'm saying is that the pharmaceutical companies are not going to conduct any research or trials on any of the people, or any extended research on any of the people that died as a result of the vaccines. Is all I'm saying. But go ahead.
And I would just add that this gets back to my point about the 100% guarantee. So those people who, because I have looked at some of what you're talking about, and those people who have actually died after being 2-dose vaccine are generally older and already chronically ill. Okay, and so the vaccine is not going to make anybody live forever. Let's get that out the way. The vaccine is not 100% guaranteed. Let's get that out of the way. What the vaccine has helped to do is to limit the people who have been hospitalized and who have died from this vaccine, so that I can take care of, let's say, 5 COVID patients in my ICU, as opposed to taking care of 100 patients in the ICU. And that is a revelation. Okay. You would hate to be sick with COVID when there are 100 other critically ill people on ventilators, multiple drips, on hemodialysis, all at the same time because of this virus. That's not where you want to be, my friend. Okay, I'm not talking to you, I'm just talking in general.
I get it. I get you.
And so when you talk about, the people have died after getting 2 doses, what we're saying is, yeah, people have died after getting 2 doses. People have been reinfected. There is a recurrence of COVID. And generally, those people, as a rule, are older already chronically critically ill or have been patients undergoing chemotherapy and have cancer or are immunosuppressed in some other way. So the vaccine is not a replacement for people's immune systems. And I think that that's really, really important when we keep in perspective, because then we're always going to be paralyzed then if the argument is, well, wait, hold on. This is not 100%. We're going to be paralyzed in the face of a pandemic and when we need action. And there is really good data on the safety and efficacy of these vaccines. And I don't think we should ignore that. And so I hear your point, brother, but I also think that everything, especially when we're in the middle of, when we're in the middle of war, just euphemistically, I don't think that you can be paralyzed and say, wait a minute, but I want to see first exactly how to move because I'm only going to counterpunch. We need to be a little bit more proactive. So I agree with you also on if we make early lifestyle changes when you're younger, hopefully the healthier you are as you get older, the less your risk factors are for developing severe disease. Because we know the people who I was seeing were diabetics, were obese, were hypertensives, who had chronic kidney disease. They had very little left in the tank of reserve to be able to fight this very, very vicious virus. So I agree with you, but to do that, you can't do that starting this week and then say, if I get the virus next week, I'm going to be good because I started to be healthy last week. No, that actually has to happen as a population from our youth on. And that's what we're talking about, developing a healthcare system that prevents disease and keeps people from developing diabetes, hypertension, and that's a separate conversation. And I agree with you on that. But also what I would say is none of those things, if you do get severe disease, are going to help you in that moment.
Hey, why? Because I know I just would be mindful of your time, but there is one new question, if you have a minute for that I don't understand. And if I'm reading it correctly, it says, when do providers use monoclonal
antibodies
in the emergency room, and what is their rate of preventing death?
So monoclonal antibodies, right, is where you basically give somebody, you infuse them with antibodies. So what do vaccines do? Vaccines provide you, we inject you with a piece of what the virus looks like. It doesn't go into your DNA. Okay, so let's stop. It doesn't change your genetic code. What it does is we're presented with antigens all the time, right? Antigens are things that are foreign to us. People who have allergies or whatever, you're presented with antigens from the environment all the time. And what your immune system does is it creates antibodies to fight off antigens, right? To then stop the disease from spreading or stop whatever that invasive thing is. And so what vaccines do is instead of you, before you're exposed to that virus or that antigen, which your body then has to ramp it up in the moment, it preps you for it. So it's like, oh, I've already seen this before. Let me get on it and let me neutralize it right now. And so that's what vaccines do in theory, broadly. Monoclonal antibodies are providing someone with those antibodies, usually through an IV infusion, so that those antibodies then go to work on the virus in that moment. I don't have the data right in front of me, but where monoclonal antibodies have been given in outpatient settings for people who have had symptomatic disease, and there was a question about what are symptoms. Symptoms are shortness of breath, cough, fever, malaise. Those are when there's asymptomatic, you have the virus, it's living on you, it's replicating, but you're not generating enough of an immune response to then feel sick. And then, so that's asymptomatic. And symptomatic is you feel ill. And they have things that make you feel, you're febrile, you have a fever, you're breathing really fast, your oxygen levels are low, you're ill, you're ill. And so in people who have come into clinic outpatient who are not sick enough to be admitted to the hospital, but are having symptomatic disease, we tried to give convalescent plasma, and they're giving convalescent plasma as a way of stopping the progression of the disease. It's almost like giving you a booster in that moment. The data has shown that there is some benefit. There's a positive for people who have then progressed to symptomatic disease. Because most of the times when you talk to COVID patients who have ended up in the ICU, they have a cough. The cough is going with COVID pneumonia. COVID pneumonia is the killer. COVID pneumonia is the killer because COVID pneumonia puts you in acute respiratory distress syndrome. Acute respiratory distress syndrome is when you have bilateral, both lungs are infected, develop inflammation, oxygen is not able to pass from the airway into the bloodstream because all of the sacs that make the transference of oxygen into the bloodstream are inflamed and filled with mucus and inflammation and water and all these other. There's a barrier. And in normal times, if you take all comers with acute respiratory distress syndrome, the mortality is 40 to 45%. 40 to 45%. Out of every 100, 40 to 45% of the patients die who come in with acute respiratory distress syndrome before COVID. Now add on acute respiratory distress syndrome. So you don't want to get this, right? Matter of fact, in the first H1N1 pandemic, we started to do newer modalities such as extracorporeal membrane oxygenation, almost like dialysis for the lung, to try to oxygenate blood because the lungs would be completely malfunctioning. They would lose all function. And so to keep people alive, we would oxygenate their blood until the lungs could recover. So now take the mortality of ARDS on top of everything that COVID also gives you, which is acute renal failure, which is increased hypercoagulability, which means that you develop more blood clots, microthrombi all through, so it's very small blood clots that are able to penetrate into the smaller blood vessels, such as capillaries. It's total body collapse most times, okay? So the reason that they tried to start convalescent plasma is because you don't want people to progress to there, because once they're symptomatic, sometimes the natural progression is symptoms that seem very light, and then over the course of several days, they progress and get worse. And then when they show up in the hospital, they're already in pure ARDS. And then you're already at a deficit, at a negative, to try to combat the illness. I hope that answers some of the question that was being provided by the
I hope so too. I won't claim to have kept up with all of that, but it just sounded like
ARDS it's killer. And I mean, that's the issue, is that most times, I'm at the point now where if you come in and you're in severe ARDS with COVID, I kind of prep family members that this is now this is gonna be a long haul, right? Because what we have to do is, and that's why when people were saying, oh, the ventilators are killing people, and I say, it's not the ventilator, it's ARDS. ARDS from before has always killed people, right? We have very, very little in terms of ways of therapeutics to combat ARDS. What we do on the ventilators, we try to minimize the pressures within the airways. What we do is we do something called lung protective strategy, and that has been studied to reduce mortality and morbidity in people. And morbidity is an important word because we talk about death, but mortality is death, but morbidity is disability. And the morbidity part is also sometimes what gets lost in this black and white conversation. Either you survive or you die. But there's a whole bunch of people who are now disabled from COVID, who survived COVID, but are disabled. And those people, it seems like, are being left out of this conversation because we want to deal in absolutes. But did you die from COVID? But did you die? No, I didn't die. But now I always feel like I'm tired. I'm having difficulties walking 1 block. You know, I am always in this brain fog. I'm forgetting things. All of these things that we have yet to, that we're learning about now, but all of these secondary effects from having COVID infection that we're learning about and trying to figure out how is it to best treat these folks? What is it that we need to do to get you, to rehabilitate you, recover you so that you get better?
Listen, my man, I love seeing you. I would want to rap with you all day. I don't know if you I don't know. Do you want to take another question? Kaba might have something else to bring up. I don't know how you feel. I mean,
listen, I'm here. This is what like Jonel's talking about. This is not my job. This is a thing that I do as a service. This is how I provide. This is what I do for my community. You know what I mean? And I don't do it to get paid. This is what I do because this is my responsibility. You know, this is why I go to 6 years of med school, another 6 years, 3 years of internal medicine training, 3 years of pulmonary critical care training. This is why you then become, if you become an assistant professor, or a professor, that you're continually having to educate yourself. I do this because I'm not out here to be a shitty doctor. I'm out here to be able to provide the best care possible in a responsible manner. So if we want to be on here for another 4 hours, we'll do that until the battery dies on these headphones or my computer. You know what I mean?
The battery is dying on this first. That's what's happening. And I do want to have you back at some point just to specifically talk about your career and to learn more about the Cuban medical experience and all of that too. So.
And just to also, and I'm here for all.
Hold on, Kaba. Hold on. I had muted you, Kaba. So
and I'll answer any questions that I can. I think there's some things that are out of I can only partially answer, but that's why this panel was so important. Having Obi on, who's an infectious disease doctor, who literally part of his training is to study vaccines, immunology, vaccinology, and infectious disease, was really critical. And I want to thank you for having us all on. But what you had was you had a really good panel of public health nursing, infectious disease docs, an emergency medical physician, and me who takes care of severe COVID cases. I think hopefully the audience got something out of today, because I think that we tend to.
I want to credit you though. I'm happy to host it. You put it together. You reached out.
Oh shit! Now I'm in trouble.
No, but I'm saying I think because
now the troll's going to show up in front of my house. You're responsible for this.
No, they don't want to do that now. Let's not get carried away now. But my point is, they don't want to do that now. But what I'm saying is that the point for me though is that of course I'm happy to host it because you all, as you all were saying, are coming out of the same struggle, out of the community with almost the exact same politics in many cases. But as was said, you went went to one direction in terms of education and practice, and others of us have gone in others. But it's from that same perspective. So. Kaba, go ahead. I'm listening. I'm going to step away real quick, but I am listening. But go ahead and raise whatever you want to raise. Okay, I'll be right back.
Yeah. Uh-oh. Is he? Are we still on?
I think he just stepped away for a second.
Okay. No, I'm here.
I'm saying, go ahead. I'll be right back. I'll be right back.
No, I was just going to say, I know I'm definitely not the expert in any of those fields, and I know that you all are, and I know that you all are coming from our perspective. I'm just saying, I believe that there are also some others who may have a different perspective who also have similar credentials. But I just wanted to say this, it's always a heated, this is a heated debate, as you know, and I definitely appreciate. So it was nothing, personal and everything, but there are some serious questions that everybody has, and so it's a beautiful thing. I also host a radio program, so I also would like to get your information through Jared to talk about your Cuban experience as well. So we could definitely talk about that. So I definitely appreciate it. But while he's gone, I'm gonna put that hat on real quick and just ask you just a little bit, if you could just tell us a little bit about your experience in Cuba. I can remember years ago helping as a group of folks finance a young lady from the States. I believe she was from New Orleans. who ended up having to go to medical school in Cuba, and she just needed to get a little financial support. And I think that the mandate was that as long as she would come back and do exactly what you're doing, working in the community, then she could come on and learn this. So can you talk just a little bit about that?
Sure. So I graduated from La Escuela Latinoamericana de Medicina, so it's the Latin American School of Medicine. It was a school that was set up after 1998 by Fidel in response to a couple of different natural disasters that had happened in Latin America, Hurricane George, Hurricane Mitch being those ones. And as most people here on the show would know, Cuba has a long history of medical internationalism and solidarity, where it has sent its physicians throughout the world to provide aid, set up healthcare systems to other folks, usually in Latin America and Africa. And what Fidel then decided after these natural disasters is, wait a minute, instead of me going and sending doctors out and providing you with fish, we need to teach those folks how to fish. And so, but he opened up a medical school in order to bring in folks throughout Latin America, train that cadre so that they could go back and be able to provide care, because sending Cuban physicians was only a Band-Aid. So, but being able to develop sustainable cadre of healthcare professionals to provide primary care was more important. And that offer got extended to the US, largely after a delegation visit by the Congressional Black Caucus. Benny Thompson is the one who is credited with asking Fidel, listen, we have lack of doctors in the Mississippi Delta. Would you train our physicians, our Black and brown citizens, to go and then come back? And he said, say no more. And so I went down in 2006, first time I had been to Cuba, graduated in 2012, spent a little over 6 years there, studying basically how to be a primary care doctor, because that is their number one, is to be able to provide training to develop high-functioning primary care doctors. I came back to the States. Only wanted to work in the public hospital system, and we can have that discussion about our public hospital system's revolutionary. By no means, but they do take care of the uninsured, similar to HBCUs, right? They're not revolutionary. They train, they educate Black folks, but they ain't revolutionary. Like I always hear you say, and it's like the same thing. We take care of Black and brown folks in New York City community, but we ain't revolutionary. I always want to just throw some shade on them. And trained in internal medicine, and then went on here in New York City to train in pulmonary and critical care disease, because what I found that I was really good at, my lane, was taking care of the critically ill. And being able to help people a lot of times because they're critically ill, supporting families through elders who are having to transition because they're in their life cycle here on this plane. So things like that. And being in an environment where I got to see what healthcare as a human right really looks like. Mm-hmm. Where healthcare is truly accessible, where when you don't have, where all treatment modalities are looked at, acupuncture, herbal medicine, not just medications and synthetic pharmaceutical medications. Mm-hmm. Although that's the mainstay of medicine, there is an understanding that medicine encompasses more than that. Encompasses the biological, the psychological, and the social. What they like to use, the buzzword here, is the social determinants of health. Well, the social determinants of health is encompassed by wellness as a whole. And that was the training that I was provided. And so that my mission was to be able to bring that back here and treat my community with those values. not the values of how much am I going to get paid and how quickly can I get out of here. And, you know, I can't hug this person because I have. That's why I don't put an MD at the end of my name.
You're not rushing people. You're not rushing people through every 10 minutes trying to make.
Yeah. And I'm a community member, because the one thing that I realized there is that I would go to work and train under doctors, but those doctors at the end of the day would have to get on the same crowded bus. They would have to wait in lines for the same food, right? They would have all the same struggles as everybody else. And that creates that provides you with a tremendous amount of humility. That'll knock out all that ego shit, like, oh, I'm better than you. No. We're all in this together. We're all in this together. And that's, you know, my wife is clowning me on it. She's like, you need to throw an MD behind your name. I'm like, man, it is what it is. I am what I am. You know what I'm saying? You know, I know what I am. I know what I do. And I know that I live, breathe. This is all I do. This is my thing. This is my lane.
Well, I know that's not what you came on. And I know that, you know, even though we had some disagreements, I did take a little quick look at the chat.
We ain't disagreeing, fam.
What I'm saying is, I think that sometimes, and I took a quick look at the chat, and what I realized is sometimes people do get very passionate and it becomes personal. And I just wanted to I wanted you to kind of, you know, give your background, just so folks know that you're on our, even though I know you said that a number of times, and you all have said that, but just let folks know that you're on our side, and that we can disagree or have varying, you know, angles that we're coming from.
First of all, whoever raised that, I'm not even looking at the chat. Whoever raised that is whack.
No, I'm not saying. I'm not necessarily.
I'm just saying, before they even get to why.
Right. I'm not even
my own point of view.
Yeah, I'm not necessarily
going to have somebody.
Go ahead.
We all good.
Yeah.
You know, can I just?
Yeah, go
ahead. Go ahead, brother.
No, go ahead, brother.
When it comes to these conversations, man, I understand where people are coming from.
Mm-hmm.
I can't. You know, it's like, you know, when talking to a Marxist, right? And saying, well, have you read, you can't talk Marxism unless you've read volume 1, 2, 3, right? Because if you just decided to learn Marxism through Walter Rodney's perspective, well, then you're not a real Marxist, you know? And when you start talking like that, in that dogmatic way, I think we can't have a conversation. Mm-hmm. Because, you know, it becomes very difficult because we're not even being able to if we can't agree on facts, if we can't get a baseline, if we can't start from somewhere, then probably this conversation is going to go off. So I have no problem, I got no problem with you challenging me, right? I got no problem. I bring a perspective. I may not agree with you. All I'll say is, hey, listen, can we agree on some facts? If we can't agree on facts, then probably this is not going to be a fruitful conversation. And also, you know, just ignore, you know, John Henry Clark, right? I only debate with my equals. All others I teach. Mm-hmm. And in this instance, not to sound arrogant, but there is a little bit of that, right? Because unless you're doing this 24/7 and really taking an honest and objective look, right? I can say, listen, I understand what the fear is, man. Capitalism is a motherfucker. And capitalism has really tainted all of this. Vaccines was pushed out so that they could get everybody back to work. Vaccines weren't pushed out so that they could keep people healthy. I can acknowledge all of that, right? But I do think that it's really important, especially on platforms like this, that we have higher height conversations on this stuff, and we stay out of the bullshit. Because the bullshit is getting us killed. The bullshit is even having people make some really poor decisions. If you don't want to get vaccinated, okay, but then don't come at me with I'm also not going to wear a mask. I also don't believe COVID is real. I also believe that, you know, X, Y, and Z are, because now we're not agreeing on just basic factual stuff, right?
Right. Well, I agree on that. I'm definitely not an equal, which is why I think that having conversations with others who are equals, who do have different perspectives is what I try to do as well. And I agree with this what you just said in general, I think it's very important. And I think that it's very important that we have these conversations ongoing, and just so that people can know that we can agree, we can disagree, and we can be, civil about it all the while. So I appreciate that.
But this is exactly why I started at the very beginning by saying from the outset that this was biased on the side of vaccinations.
You did say that.
Perspective of these experts, right? I did not say it was the end of the conversation. I didn't even preclude the possibility that there are experts who would disagree, who might even be on his level and disagree. I'm just saying that's where we were coming from today. The only thing that I am getting a little amped over, and I'm not looking at the comments on this right now, is this the idea that even before we get to the specifics of my man Joaquin, that I or any of us here would be inviting some whack agent, silly, whatever. That's I'm like, I take offense to that. Like, we don't have to agree, but like that. And so anyway, I'm just kind of, but so that's
yo.
Thing, so.
I love Black Power Media. Black Power Media is like on in my crib, in the office. I put it on. I mean, I think y'all are doing amazing work, and really opening up a space that we sorely need as a community. And I want to thank both of y'all and everybody else. Kalanchi's crazy behind, Kamal, Dr. CBS, everybody for the hard work that y'all have put in, the ear doctor, everybody for the work that y'all are putting in, because I think, this is an amazing space. And the fact that we can have these discussions is so important for us, where we're bringing on folks who have, wide range of experiences. And I just want to thank you, man. You know what I mean? I've learned a lot from this channel.
Yeah, appreciate you, man. Thank you. And I hope Sister May sees that and clips that little PSA you just gave us. I appreciate that. But listen, man, man, love to you and your family. I look forward to seeing you all very soon. And thanks, Wow, for coming through, man. And we look forward to doing this again. I really appreciate you.
And brother, I'm not getting the vaccine. I do know that COVID is real. And I am going to wear my mask. I'm getting ready to go somewhere right now to wear my mask. So we're there on that.
At all times. Yeah, wear your mask at all times. For folks who are outside, I would even say if you're gathering in large groups and you're unvaccinated, please still wear a mask even outside. Please take care of yourself. Take your vitamins, hydrate, eat well, exercise, do all of those things, and most importantly, take care of yourself. Yes, sir.
All right, my man. Take care, man. Appreciate you, man. Peace. Thank you very much. Hey, man, I love that dude to death, man. And I appreciate him for putting this together and coming through.
Yeah. And my bad for coming in and smashing up the China,
Nah, man, it's all good, man. It's all good. I just wanted to, anyway, it's all good.
I probably should have just stayed off. Because this was because you did say that it was a one-sided piece. I actually am going to have my own one-sided show with some other doctors as well, probably in the next month or so on my program, to have a different perspective. And so I'll invite people when the time comes. We're still gathering folks now, but yeah, I mean, I think it's still important just to have the conversation and just to get because they did touch on a lot of the questions that people are raising, and then that'll help me to kind of like direct the conversation that I'm going to have folks kind of review this as well. So I think that at the end of the day, for me, it's just about getting the proper information and in the proper perspective. And so, I'll just leave it at that. But I appreciate it, man.
Fair enough. And likewise, and again, my only issue is that in the same way that I wouldn't want to be demeaning to people who are not getting vaccinated. I'm a little bit admittedly defensive around the issue of
I don't beat up on anybody. I don't beat up on anybody that vaccinates.
I'm not saying you.
I got loved ones that do. I'm not calling people stupid. I'm not doing anything because I'm just saying that for the people that do that, because I don't think it's helpful. And it also just drives further divisions. We got enough division within us as a people. Respect people if they want to get the vaccine. I say respect people if they don't want to get the vaccine, and it's principle. And just leave it at that. But we don't need to start attacking each other. We already under attack, and we don't need to add to it.
All right, so listen, unfortunately, I have to go, but let me just remind folks that tonight is going to be a lot of live here at BPM on Friday night. So we're going to have At 8:00 p.m. Eastern time, Brother Jay from X-Clan will be live on the Riot Starter.
The grand
and then
verbalizer.
right after that, that's right. And then right after that, Daddy O, the legendary Daddy O from Stetson Sonic.
It's the band called Stet, my man. And we're on fire, on fire, on fire. That's he got to do that tonight.
I hope the word has been put out on that. No. I'm saying I hope that is the word that has been put out on that. So make sure that happens. That's at 9:00 right after the Riot Starter. That'll be a live Renegade Culture right here at BPM starting at 8:00, then 9:00. And of course, we don't mind if you jump over to see Burn It Down with Kim Brown at 5 p.m. And then Monday, before or after you come back here for my show, you can go check out Kaba, who's going to be talking about. You don't know yet.
I ain't even playing it yet, brother. It's Friday too, and I guess I better get to work.
It might even be the vaccine. You might even have the vaccine coming.
No, I'm not gonna. It's too. No, I'm not gonna have them on yet. No, not yet.
Okay.
It'll be a minute for that.
Anyway, well, I appreciate you.
I might have you on. Talk about that blistering and yet heartfelt, tribute. I guess it was a tribute that you gave the other day. It's very important, man. That was powerful, brother. That was very powerful.
I appreciate that. I'd be happy to talk more about it. But yeah, I hope it was seen as a tribute. I mean, I clearly love the man,
Yeah, clearly.
You
got daddy issues, man. That's all. You just got daddy issues.
That's real too. I have no, I mean, that's absolutely the truth. And that's why I said I was projecting stuff on
a lot of people can relate.
He never agreed. I know they can. That's why I'm saying I know people. I mean, that's why, and that's why, but like I said, he never promised all of that. So, and that's why I had to get over what I had to get over. Yeah. But it is what it is. So, but anytime, man.
Again, let's do that. Let's do that. Let's book that because I want to get further into that. Yeah, let's do that. Right. We'll talk off the air about times and whatnot.
All right. Make sure you text and remind me because
Monday from 3 to 5. Monday between 3 and 5 Eastern time. Brother Jared Ball is going to be on 89.3 with me talking about that.
There it is. So get out and support Katia Stitt because she supports and has helped run that station. So so I'm we want to keep supporting her, and I look forward to it. I look forward to rapping with you on Monday.
Yes, sir.
So let's go. All right, everybody. Peace if you're willing to fight for it. Like Fred used to say, thanks to all the guests, everybody in the chat and the comments. Look forward to much more here at BPM and elsewhere. Catch you in the whirlwind, everybody. Peace. I mix what I like, what I like, what I like, what I like.